I'm Ben Pham. I'm a vascular surgeon at Swedish. I did my training at UCLA Harbor for general surgery. I did my vascular surgery fellowship at Stanford, and I came up to Swedish immediately after training. I valued Swedish very highly because it had residents. There's a very strong general surgery training program here, and they always have a resident on service that works with the vascular surgeons. My passion is teaching, and so having residents and being able to nurture and train the next generation of surgeons is what brings me joy in life, other than taking good care of patients. Our team consists of the surgeons, our advanced practitioners, including our PAs and nurse practitioners, our medical assistants and front office staff, ensures everything is seamless for our patients. We make sure that you have all the information you need to come to your appointment. You have all the information you need to successfully be ready for surgery should you need it, and that afterwards you have very clear instructions about how to follow up, what medications to take, and in the end, why everything was done the way it was done. I guess one thing for vascular surgery that draws you in is that when you start treating a patient in vascular surgery, they're your patient for life. Usually we treat problems that are chronic diseases. If we're treating you for your claudication or pain that you have when you're walking, to be able to help you get through that, whether with medication or with surgery, and get you walking again and enjoying life again, that's a win for us, and we follow you for the rest of your life for that. If we treat you for an aneurysm, it doesn't mean that you're not at risk for aneurysms in other locations, or that aneurysm doesn't need to have surveillance moving forward. And so typically we follow you for the rest of your life for that as well. Vascular diseases most of the time are chronic problems, and so we are doing you a disservice if all we're doing is treating your aneurysm, but we're not treating the underlying causes that led to the aneurysm. Having lifelong relationships with patients it's wonderful. I think being able to help them in ways outside of surgery is very rewarding.